Hello, I'm Sharon Benjamin, host of Leafless, Not Lifeless. I am so happy that you've joined me for another episode where I look for people who are maybe appear to others to be leafless, not lifeless, but also people who are helping others to maximize their potential. And my guest is one such person today. Thank you, Johnnie
Geathers.
Geathers. You know what? I have been practicing that, and for what reason, I don't know why I was doing the gear. Maybe you shift from one thing to the next. Johnnie Geathers, thank you so much. I really appreciate your time. I know you're a busy man, but thank you so much. I really appreciate it. And so we'll be talking about how you are helping others and how you started out early on and how you are doing that. And the bulk of our conversation, for those of you who are listening and watching, will be talking about men and mental health, which is such a crucial topic at this time. So Johnnie Geathers, thank you so much again. So starting out, you have been actually influencing and helping others from your teenage years. You started out as a candy striper. What was it that triggered that particular time in your life?
So at that time, when I was 15 years old, I always wanted to like volunteer and help out with others. And at that time, I was like interested in volunteering at hospitals. So I had found like this opportunity to be a candy striper at Pennsylvania Hospital, which is a hospital in downtown Philadelphia. And for people that's out there that's wondering what a candy striper does, a candy striper actually assists the nurses and the doctors with certain things, check on the patients. If the patients need like water, snacks, and those things like that, you give it to them. And also be there to, just check on them for like support and those things. And I loved it. With that experience, it was during the summer. It was a summer program. I had the candy striper uniform, so I had the white the white scrubs, and then the shirts. But the shirt was a candy. It was like a candy striper, candy cane colored and everything.
Okay.
Had my little badge and everything, and it kind of felt good to just get up and go to the hospital Monday through Friday and help out and stuff. And then plus on top of that, we was getting meal vouchers to eat lunch and stuff in the cafeteria
Yes,
and those things. So it was a good experience,
that's
and that kind of actually shaped into me saying I love helping people.
that's awesome. That's awesome. So, and I think that's really important for those who are listening and watching, and for young people. Um, because when you go off to college, I've said so many times, it's not just the 4.0 that makes a difference, but colleges are looking for well-rounded people as well. And on that note, you actually volunteered at the McDonald's house, Ronald
Yeah.
McDonald
Yeah.
House, and in college with AmeriCorps. So how did those volunteer experiences compare to your working as a candy striper?
So basically with the Ronald McDonald House, I did something with them during my senior year of high school. During my senior year of high school, I was the school president. So we ended up doing a toy drive just for the Ronald McDonald House. Currently, right now, I still do volunteer work with the Ronald McDonald House here in Pittsburgh with my fraternity, Iota Phi Theta Fraternity Incorporated. We do a lot of things where we serve meals. We do toy drives for them, also give out donations like gift cards and those things to the patients and families. But what I did with AmeriCorps was something different. So with AmeriCorps, I actually worked at a summer camp for AmeriCorps, and that was during my junior and senior year during undergrad at Penn State. So I was like a camp counselor working with, the youth in Philadelphia. And what makes it different, like what made it different, I feel like the only thing I could say was different was the age. Because, at the summer camp, I'm working with younger kids. And at the hospital as a candy striper, I was with adults.
So you, at some point, you mentioned that you wanted to be a pediatrician, but you shifted
Mhm.
to social work. What
Yeah.
what was the impetus?
So my interest in wanting to be a pediatrician stemmed from my experience being a candy striper, being in the hospital, because I had loved being in that environment and how it was like interactive, fast paced and stuff. And from there, what shifted into social work was my junior, yeah, might say my junior and senior year, figuring out what to do next. And around that time, my siblings were the main experience. I'm the oldest child of my family. I have one brother and two sisters. They were at that time during undergrad, they was young. They was 4, 5, 6 year olds at that time then. And with them, I always used to be like, I always used to ask my mom, like, why are they doing these certain things? And I never used to do that when I was a kid and stuff. So that kind of made me get more interested in learning more about why we do the things we do. Not just within like a lens of psychology, but also the lens of like our upbringing, our surroundings, our environments, and those different things. And when I was explaining those things to one of my fraternity brothers, he told me about social work. He said, I think you should apply to go into grad school and everything into social work. And that's when my interest into social work shifted from there. And when I applied to the schools, I applied to Columbia University and Pitt. And Pitt was my number one choice. And when I got accepted into Pitt, the rest was history. Now, when it went into to the aspect of being a therapist and going into therapy, it shifted to that moment during both of my years of grad school because we had to do field practicums. And with the field practicum, my second year in grad school, the field practicum was I was actually a therapist. I was working at Mercy Behavioral Health, doing individual and group therapy for individuals that had comorbid disorders, which for anyone that's out there, comorbid means that it's a person that's dealing with a mental health diagnosis, but also dealing with either substance use or alcohol abuse.
So I know that, so you just talked about that experience in graduate school, how you were working as a therapist, but can you think of anything from your prior experiences that you talked about building you for those moments?
So prior moments for building me into those moments of doing like the field practicums and even getting into the aspect of social work, I'll say just my involvement overall in the community. So like when I was a freshman at Penn State, I joined this student government organization called the Association of Residence Hall Students, and I was diversity chair. So mainly what I was doing within my role was provide like hosting events around campus just to get everybody to come together, regardless of who you are, where you come from. I had wanted to just make, the campus a nice, place to be at and everything. Cause there's so much stigma within a PWI to say that there's not that much culture, there's not much diversity. But at that time, during that time when I was there during undergrad, it was showing that is culture, there's diversity and stuff. So with me being the diversity chair, I was able to host different events, but also collaborate with different organizations to be able to push out different things. Also with me joining my fraternity, I joined my fraternity during my junior year in college. And from there, I was doing a lot of different community service work and connected with different organizations off campus to just actually still give out that moment of, helping the community, helping students, and even helping like, older adults as well. So it expands. So basically overall community service, that was like a big thing for me. And like I said, it stemmed from my teenage life, and it just carried on to now. I'm 33 and I'm still involved in my fraternity. I have a leadership position locally, regionally, and nationally, and it all ties into community service.
So
And
this,
what my work, and then also with my work as a therapist, it actually shows that I'm making an impact because all I see is service.
yes, so the strand has continued. It's all connected. Now, you mentioned something in your comments about how sometimes people say there's not much culture at a PWI. So tell the audience, I know what that is, but
Yeah.
make sure the audience understands that.
So a PWI, for anyone that doesn't know what that stands for, a PWI is a public white institution. So, those are, your typical schools. So like Penn State, you have IUP, you have Penn, You have those different universities that are catered mostly to, you know, individuals outside of, you know, the minorities, even though minorities are in those particular schools, but we know that the population majority of the student population is not a minority.
Right.
And with the culture aspect of bringing everybody together, that's why there's different organizations that help cater to, you know, minorities. So at Penn State, when I was there undergrad, it still exists today because I always take a visit to Penn State for different events. So there's the African Student Association, there's the Black Caucus, there's the NAACP. Even though my student government organization I was part of was majority, you know, not a minorities was in that organization, but I was the one that created that change because I was the only Black male in that organization. And plus, with me being the diversity chair, it actually transcended the organization to where more people like me was able to say, all right, I want to be part of this, you know, part of the student government and stuff and make change. So that's what, you know, what a PWI is. And we all know our HBCUs are historically Black colleges and universities. So, you know, FAMU, you have
Howard,
Howard, you have Morgan, you
Hampton,
know, those Cheney, Lincoln, you
Towson
know, all
State,
those, yep, all those schools.
Lincoln.
Mm-hmm.
Yes, yes. So as a mental health therapist, as I said in the intro, we want to talk about men and mental health because sometimes there is such a, so in the African American community, or maybe, and you can talk more about this, but maybe just in general, do you find it to be an issue overall, or is it, do you see it more so with in the African American community?
Okay, in terms of mental health,
And talking about it
and talking about it in general, I feel like overall, I could say, to be honest, within these last few years, coming from, you know, even though we're still in the pandemic, but it doesn't seem like we're in it, but stemming from the pandemic into like going into now, we can see that mental health is being talked about in the Black community. And it's for like different people that's hosting different events. Like yesterday, I was at an event where I had to speak about what mental health is to a community and what does it look like? Because as soon as you hear the word mental health, automatically people assume that, oh, it's for crazy people. But really, mental health is our overall well-being and how that ties to what we do on our, you know, in our everyday life. And the scenario that I normally use for, you know, explaining mental health is that our body is a system. And I learned this from grad school that our body runs as a system. So if we don't take care of our mental health, the other parts of our system can crash and burn. Just like with a car, the basic things that we need with a car is gas. We need a, you know, steering wheel. We need wheels. We need oil
oil.
changes. All those different things. But if we don't take care of those particular things, the car's not going to run. Same thing as a tie to our body. If we don't take care of our mental health and our well-being, our body can crash and burn and those things. And when it comes to the Black community, it's important for us to educate that it's okay to talk about mental health. It's okay that, you know, we need to seek services to be able to make sure our well-being is fine. And I do want to, you know, tie into men in general. Men already have two moments in life that they have to uphold to.
And what are
One
those?
is, I feel one is power and the other one is pride. So power, we already know within history in itself, we always know that men have to be the head of the household. Men have to be the breadwinner. Men have to be the one that has to uphold the most in every aspect, wherever, if you're in a family, if wherever you're out in the environment, those different things. Also with pride, men have to always hold that they're strong. They always have to hold that they have a strong, you know, that strong demeanor and everything. But most of the time, all men are not like that. And if a Black male, and I want to say that if a Black male actually goes to go see a therapist or to see a counselor, they might get shunned upon because most of society would say, "Oh, you're going to seek help. You're weak." That shows a sign of weakness. But in a sense, we need to change that narrative and say that no, that individual that's going to, to get therapy, that's not a weakness, that's a strength because they want to build more within themselves so they can be able to move forward in life.
I
Life
have
is
such
hard. Life is hard. Life is tough, and we don't have it all together, especially as men. Because we already know that in society, it's always known that, oh, women are known to show their emotions. Women are known to be so vulnerable. But now, with the shift of saying that it's okay for men to show their feelings, it's okay for men to cry, it's okay for men to even share what they're going through because we are human. Men are human. We're all human, and we have those emotions and stuff. If we wasn't able to share the things that we're going, that we're going through, it's going to keep building up and up and up. And once we build up, we can't hold no more and we explode. We
I dare
explode at
say
the wrong time. We explode at the wrong person. And we just, have a full release. But if there's a moment we can say, okay, share what you're feeling, share what you're going through, then that person can be able to regulate themselves.
so. And I love all of that you just said, and it is so true. And it's the actor who just recently committed suicide, not sharing and having to pretend to be strong and to pretend to be all together. So how do you help, in particular, how do you help men to break beyond what you just said is a reality?
Yeah.
How do you do that without
So with
making so that the men will still feel I'm still a man, I'm still strong, I'm still the head of the house, I'm still supporting, I still like football, but how do you help them to break forth, break that glass?
break the glass. So for me, with because I want to explain to everybody that I work for two organizations. So my full-time job was with Family Links, and I work mainly with the younger kids. I work with the youth. Now, with my second job, Hand in Hand Counseling Services LLC, which is a private practice, I work with everybody across the board, from children through adults. So with the men that I have on my caseload at Hand in Hand, I always tell them that, I'm here to help you out. I'm here to be your guide so you can be able to be comfortable to share what you're going through, to share what you're feeling. And I even will disclose some of my experiences of what I've been through growing up because I'll tell them, yeah, I've been to therapy before, as well. And stuff just for me to release my emotions, but also be able to get a second ear or be a way to vent certain things I'm going through so I can push forward in life and do the stuff that I love to do. So I allow the men to be able to have that open space for them to be able to just share what's on their mind, be able to release what they're going through, and to be able to just say that they have somebody that is a man that could be able to relate to what they're going through. So I feel as though what is important for men to be able to be open into therapy is that they one have to be comfortable, and that it's all important in terms of build a relationship, and that's the first thing you have to do in order to have a therapeutic experience. You have to have a relationship with your therapist. If you feel like you're not able to connect with that therapist right off the gate, it's okay to find another therapist and stuff. And also, what I want to share out there too is that it could be a moment where you can say, okay, I want to seek. So, say for example, if the guy want to seek me because I'm a man, yeah, they can seek me as a, being the therapist for them as a man, but there might be a time that I might not be able to provide those things that they need from me. So I also recommend them to say, I think you need to go to another therapist or go to a female therapist to share the things that you're going through because I might not be able to relate to you and stuff. So basically having that overall one, building that relationship, but also being able to be open and be honest with them to say, okay, I could be able to help you out with this, but or also say, okay, I'm not able to help you out with this, but I could give you some recommendations and stuff. But I think with men in general, we just have to be able to just, in order to break that glass, I think it's more so to just be comfortable, but then also be able to build, confidence within yourself to say it's okay to get some help. It's okay to, not be okay. It's okay to feel like you need to get another, another view on things so you can be able to push forward in life.
So, so with this initial conversation, I have no experience in the area, but I'm guessing that even with giving that wonderful introduction, there may be times when the men will still say no. Um, how what are some strategies perhaps that you use to help them to get to a point where they will, let's just say, if they do decide to stay, for them to start opening up, to really start sharing? Because, I'm guessing that in the line of work, that there are times when the client or the patient might be sharing with you, but you can tell that the person is basically sharing from the top, is
Okay.
sharing surface information.
Yeah. So for me, the way I start every therapy session is I actually ask them, I check in with them. I always check in and say, how are you doing? Just to get off the rip, like how they really feel. And I always say, be honest, how you feeling? Because I can tell body language is a key component into noticing what you're really going through. And I say, just be honest, tell me like how you're feeling. And once they tell me they're feeling, then I ask, well, what makes you feel this way? What is something that happened today? Give me some updates of what's been going on since our last, since the previous session, or even before you came to me as the first session. What are some things that's been going on? And I let them lead the conversation. From there, based on like their goals and stuff that they're working on, I always do plan out certain things in advance of what I want to work with them on. But if something goes left where they just want to have a event session, I let them take charge, because that's what it's all about. I'm not just there to be a teacher or to be someone to say, oh, I think you should do it this way, do it that way. I'll let you guide the session. I'll let you guide the session, and then I'll take some notes and jot down some stuff that stuck out to me. And whatever certain things that stuck out to me, that's when I'll bring it up and say, well, I noticed that this had happened. Can you tell me more about this? And if they say I'm not ready to share it, then I say, okay, it's all right. You don't want to share right then and there, but I'm just going to let you know whenever you're ready, I'm ready. So just giving them that, allowing them to have that self-determination feeling to say that, okay, he's not forcing me to do anything or say anything until I'm comfortable to be able to do it. And that's why it's important to build relationship, because you already know what your client will be capable of sharing, and you already know what your client is not capable of sharing. But you know that once you build the relationship more, they will be able to open up more.
And you mentioned something about just allowing them to talk and allowing them without your being the moderator, the teacher. Although the trained therapist knows to sit there and let them talk. But as you were saying that, I was thinking, and especially with men, it seems as if you are helping them to make sure that they still have some power.
Yep. Yes.
Which I think is really important, especially for men. I know my husband and I have been married for 38, 39 years, and I'm an educator. So, that educator voice, and I don't plan to, it's not that I'm teaching, but sometimes it might come across that way. So you're being the therapist and knowing and understanding, okay, I'm not trying to teach you anything right now. I just want to hear you.
Yep.
Hear you, and then perhaps make some suggestions or ideas. And it sounds as if as you're letting them talk, you are actually helping them to help themselves, helping them to help you make a plan for them.
Yep. Yes, definitely. Definitely. Because even like, and the thing is, what I had learned is that you could always be prepared for your sessions, but you don't know you don't know what to expect, because certain things can happen. You never know if your client is dealing with a crisis. You don't know if a client is dealing with like a transition in their life and it's like hitting them and stuff. So that's why it's important. Like for me, normally when I check in with them and ask for like any updates of what's going on, I'll let them, take charge and lead. And if they say, well, no, I don't have nothing new going on, then that's when I go into the stuff that I have planned out related to their goals. But if they have something that's really going on that they really want to talk more on, I'll let them run the show. And then at the end, when it's time to check, like close out, I always check out at the end. I say, well, how do you feel now after, going, talking about this or even going through an exercise or something or learning coping strategies in a session. And what I also do as well for men to be able to have that power still, and which I do it for all my clients regardless, is that I always ask, what do you want to do at the next session? What's your plan? What you want to do for the next session? I don't tell them this, all right, next session, we're going to do this. I ask them, what do they want to do for the next session? And they'll tell me, they'll say, okay, I want to work on this for the next session. I'm like, okay, let's do it. Or if they say, I don't know, and they'll say, well, I want you to pick. And I say, well, all right, I'll pick something, but it'll be tied to your goal. And
So
go
I
from there.
love, as he said, so it's wonderful how you are actually, you're observing and watching and seeing the potential and actually helping the people to grow into their full potential. Seeing that they have the potential, they're not lifeless. There is possibility there. And I think you might have addressed this a little bit before, but what do you see as the main obstacle for men to actually just say, I want therapy, or to open up and really engage with their well-being, or they're growing into their potential well-being? What do you see as the greatest obstacle, perhaps?
I think the obstacle that men have when it comes to even wanting to go to therapy or any other mental health service, I think it's a moment of fear. I think, and the reason why I think it's a moment of fear because with us men, like I said before, most men hold stuff in, and with holding those things in, so like taking it from like experiences from childhood, experiences from teenage years, early adulthood, even if you're going into later in life and stuff, and you holding all that stuff, carrying all that baggage, and then when it's time that you want to feel like you need to go to services, have services or anything, you are fearful of what someone might think of you. It's that judgment aspect. So I think that's the biggest obstacle to say, I'm a man. I'm supposed to have my stuff together, but I don't have it all the way together. So with me, with men going into, seeing a therapist, and most of the times, in which I think this is changing now too, where most of the therapists are women and everything. And because we know in mental health and social work, it's a women dominated, profession
Mhm.
and field of work that it's like I don't even want to go tell my feelings and my stuff to to a woman and everything. But like I said before, it's more of being able to have that relationship so they can break down that wall of fear and not being judged.
And not being judged. You're right. As I said before, sometimes people are, you might see them come in, and as I said before, they are initially just talking surface. They're not giving the true feeling. They're not, because, as you said, feeling like they will be judged. And society has done a number of things too to make people, kind of feel like, oh, if, as you said before, if I go, they're going to think I'm crazy. They're going to think I'm funny. They're going to think if something's wrong with me. What will
Yeah.
they think of my job if they find out I'm going to a therapist? What will my
Mm-hmm.
family think? What will the community think? I'm president of all of these organizations, and uh, so. But this is wonderful, and I think that we need to talk more about this, men and
Yes.
mental health, because so many men are, you go to the football games, or you go to the what is it, the football parties and etc.
Mm-hmm.
And it's easy to talk about those things, I guess.
Yeah. Yeah.
as opposed to, what's really going on. So, Johnnie, you are helping to uplift people and so many other things. Tell us about some of the other organizations. I know you're a member of Omega Sci-Fi. I won't say the whole.
I'm a member of Iota Phi Theta.
Sorry.
No, and the crazy, you're not the only one because yesterday when I was at an event and the person was reading my bio, they didn't know how to pronounce it, and the people in the audience was like, "Is he a Q?" And I said, "No, I'm not a Q. I'm not a Q." So, but all right. So within the organizations I'm a part of, so first I'm a member of Iota Phi Theta Fraternity Incorporated. I joined my organization fall 2009 at Penn State, and currently I'm part of Beta Omicron Omega Alumni Chapter here in Pittsburgh, Pennsylvania. Within the chapter, I am the chapter secretary and community service liaison. On top of the fraternity, I have a regional position. My regional position is director of community service. So I make sure all 6 states within my region are submitting their community service hours and documentation. And then as well, nationally, I am the national coordinator for Theta Men Improving Through Mental Empowerment, which is a brand new initiative that I helped create over a year. Yeah, actually over a year now. And no, not even over a year. I'll say over 2 years now. Over 2 years now that focuses on mental health, financial wellness, and legal wellness. So we educate the brothers on those different aspects, and then we're actually trying to expand it so different chapters across the nation can host events and stuff in their respective, cities and campuses. So outside of IOTA, I'm a board member for Pitt Social Work Alumni Advisory Board. I've been a board member for 2 years now, and within the board, I'm actually a engagement subcommittee chair, where I make sure that the board is coming together to host different events within the community, and also getting like different alumni involved into the School of Social Work and stuff. Um, I'm a board member for the Jaquan Lavender Foundation, which I joined that foundation last year. And mainly what I do is just help out with different events and programming for the foundation within the community. Now, the foundation is housed in Steubenville, Ohio, but what the foundation is planning to do is expand to different areas. So they're trying to expand here in Pittsburgh and just other neighboring areas. Also, along with the foundation, I am the lead him director. So what that is with the lead him program, it's a mentorship program for our middle and high school boys. And there's a lead her program, which is for our middle and high school females, but that's ran other, the female that's in charge of it. Outside of that, I'm a brand ambassador for Mental Health Tees, which is one of my close friends who is a licensed clinical social worker. She created a mental health t-shirt line in 2019, and I became a brand ambassador for it. Just pushing out, mental health awareness through clothing. So it's expanded it started out with t-shirts, and it expanded from t-shirts to sweatsuits, workout gear, laptop covers, mugs, all different things, all that in the above.
Yeah, wow, that sounds good. So we can't see all of the awards and particular events in your life, but we see a few of them behind you. This is
Yeah.
awesome. I love it because Leafless, Not Lifeless, you are certainly personify that and really helping others to see their potential and to grow. Johnnie Geathers, I'm so glad you took, wow, with all of that, you took some time to be here with me on Leafless, Not Lifeless. Thank you so much. I really appreciate your time.
Thank you for having me.
Yeah, so thank you for listening, those of you listening and viewing, and I really appreciate it. So perhaps you are helping others as well. I'd love to share your story. Contact me at leaflessnotlifeless@gmail.com. And thank you so much for listening and watching. Feel free to share the story. And thank you so much. And I will see you the next time. And Johnnie, thank you so much for being here.
Thank you.